With me now is Dr. Mary Dagen of West Shore Family Medicine. Is that correct?
Yes, it is.
Okay, I got the right place. And Dr. Dagen, this really dates me because, boy, do I suddenly feel old when the doctor is younger than my children. but that doesn't take away from your professionalism. I hear wonderful things about you all the time. So tell me some of your experience with ADD and ADHD.
Well, I do primary care, so I see any age range from newborn to the elderly. ADHD affects every age, over the age of 7 predominantly. So obviously seeing children, I see this pretty often. I have a really good smattering in my practice of all ages, so it's always a challenge to know how to appropriately treat, and that's why I came tonight to just kind of present some of that general information so the public knows kind of what they should be looking for.
Sure, some identifying factors. So is it usually diagnosed by age 7 now?
The current guidelines are that by the age of 7, we can diagnose that. Symptoms are usually present before the age of 7, although we do have a newer emergence of this disease in our later adolescence, and so we're trying to pick up those. The guidelines are going to change supposedly next month, but we never know in the medical field if that actually is going to happen. So if those new guidelines come out, I think it will encompass a greater population of people that we might be able to pick up more that we might be missing right now.
Okay, well, that's very important. I suppose the sooner you get it, the sooner you can start performing some kind of what do you do? I mean, there's all kinds of different methods for treating ADD and ADHD.
Absolutely. I think that it's important to remember that medication might not be the only answer, and that's true even from a primary care standpoint. We look at behavioral therapy, which is the first line recommendation for a lot of age groups. So a lot of people come into the office just wanting medications. A lot of parents don't know what else to ask for, but focusing both in the home and the school systems and working together to help these kids succeed the best that they can is really what we're looking for, not just to medicate them.
That's wonderful, yes, because you hear so much about kids just getting put, and you'll even hear that there's some schools and teachers that will suggest get your kid on medication. They need to be on Adderall. They need to be on, all these medications, and now we're finding out that medicating kids are not, it's not the best thing to do. It's not the best option. So I'm really glad to see that we're doing a little more holistic approach, and I know that you're all about that, and I'm thankful you're here. Well, thank you. I look forward to hearing you speak this evening. Do you want to give us a little plug for West Shore Family Medicine?
Yep, I work at West Shore Family Medicine through Mercy Health Partners. There's 10 providers there, so it's a great practice.
It's a great practice, and if anybody needs or is looking for a doctor, do they have openings?
I can't speak of. I know most of us, unfortunately, are closed to new patients, but we always make exceptions. I know a lot of people are in need of a primary care provider, so we appreciate the calls, and certainly we treat case by case.
Okay. Well, thank you very much, Mary.
Thank you. So what do we do? The child usually needs a medical exam. I have a lot of people that say, well, what are you going to do? I can tell you what's wrong with my child. They can't focus. The teacher says they can't focus. Well, there's a couple other things that need to be evaluated. Besides trying to figure out if they have one of those other disorders, we probably should look at them medically and make sure they're hearing okay. If a child can't hear appropriately, or if they have repeated ear infections that can affect their hearing, well, that's a great reason for why they probably aren't paying attention, because they can't hear. Vision, of course, is another important thing that we need to evaluate. So we do need to see these kids, of course. And then I don't know if you guys have heard about rating scales. I know the educators have, because they're usually a part of it. And these are checklists for both parents and for educators to fill out. And again, that's important because we should be seeing these symptoms in both environments. So not just in the school system and not just at home. I did put an example up here, but I know this is really difficult to see. So this just gives you an example. The one on the left is the teacher's rating scale, and the one on the right is the parent rating scale. But it kind of helps us as clinicians define, is this really an attention problem, or is the child suffering more from anxiety or depression? So it kind of helps us guide them a little bit. So then we talk about treatment. Everybody knows about stimulants. These are the most widely used treatments. So I listed some of them up there, the most common names. Ritalin has been around forever. And some of the newer medications are listed up there. The stimulants, in a child who actually has a diagnosis of ADHD, 70 to 80% of them respond positively to being on stimulants. So these medications have been around for a really long time. I forgot to look up when they were discovered, although I know that you're talking about it, and so maybe you have some information. But they've been around for a very long time, and they've been effective over the years. Studies have shown positive, so that kids can focus. how they work is they affect the brain, they affect the neurotransmitter norepinephrine and dopamine, which are really big words. They're things that work in our brain to help us focus, help us not be stressed out or depressed, and so it directly affects that pathway. These medications don't come without side effects. Although they can be really effective, we have to be really picky about what kids we put on these. They can drastically affect appetite. So these kids tend to not eat very well. So of course, in a 7-year-old, I need to make sure they're growing and that they're not going to fall off my growth curve. So this is a really important thing to keep in mind. If they're taken too late in the day, it will cause problems sleeping. And of course, we want our kids sleeping so that they can focus the next day. So we have to be a little bit careful, especially on weekends or on off-school times, that they're not waking up at 10 a.m. and taking these at noon. And then finally, as I had mentioned, if the child is actually suffering from anxiety and we try to treat ADHD, it worsens the anxiety significantly. So their symptoms will be amplified by about 100. So these medications can actually cause anxiety. As a kind of a comparison of what these medications would be is caffeine, like super amplified. All these energy drinks put into one. So that's kind of how these meds work. And then we look at the other spectrum of things, of non-stimulants. And again, I listed most of the common ones there, although there's plenty of other ones. Wellbutrin's been around for a long time, Strattera's been around, and then some of the newer ones. These still affect that same pathway, but they don't directly affect it. So they still work in the brain, but they affect it on a different level so that they're not direct stimulants. So they come with significantly less side effects. The downside of these medications for a lot of parents is they have to be taken every day. So a lot of parents say, you know what, on weekends I want my kid to be a kid. If they can't focus, they can't focus. On summer holiday, I don't want my kid taking medication. These are not ideal in that situation because they only work if they're taken every day for the most part. These are not quick fixes versus the stimulants. If you take a dose of stimulant, it's going to work. If you take a dose of this, you really have to take it consistently to see the benefits. So, but we don't have to worry as much about weight loss or growth. We don't have to worry as much about insomnia and those sort of things with the non-stimulants. So how do I decide what I do? And are medications the only answer? The answer to that is absolutely not. There is behavioral therapy, which I'll talk about in just a second. But these are our technical medical guidelines. I can tell you, I personally don't always follow these guidelines. I know most clinicians don't follow guidelines, but this is what's recommended so that you know, based on maybe how old your child is, what you can at least talk to the provider about. So in our preschool age, in a 4 to 5-year-old, behavioral therapy is by far the first line. I do not want to start a 5-year-old on a medication. And so working with them to do some alternative things is definitely the way to go. And if you give that a good try and the child still is not succeeding and is not able to focus, then looking at adding a medication, because again, the stimulants have been shown to be very effective. So trying that or a non-stimulant. In our slightly older population, our elementary age, 6 to 11-year-old, stimulants are really the first line because, again, they can be very effective. This is an age group where their development is still moving along, but now we're focusing more on education, and so we want them to be able to focus more during the day. And behavioral therapy did not fall off. That's still just as important, but the first line is to get them going on some medication. And then in our older adolescent age, which again is where we're seeing a big emergence of this disease, medications and behavioral therapy go hand in hand at this point. So we don't really know which is better to start out with, but they're both always recommended for any age. Behavioral therapy is definitely something we can't forget about.